Even though we are seeing an uptick in coronavirus cases, it's now growing at a slower rate. Globally, we are just short of hitting 4.2 million confirmed COVID-19 cases. The virus has killed over 268,000 people around the world. Here in the US, we have surpassed the 1.3 million mark confirmed cases and over 80,600 deaths. Joining us for more now is Anjalee Khemlani. Anjalee, today I think all eyes are going to be on Dr. Anthony Fauci. He's going to be testifying before the Senate remotely on how to reopen the economy. This is going to be happening in about an hour from now. What do we expect him to say?
Yes, Alexis. So we're expecting him as well as Dr. Redfield to really discuss just everything about the reopening. We've already heard the New York Times reported that Fauci is going to be talking about specifically how dangerous it is to reopen. We know that we've seen the projections sort of back that up. In their increase in the estimated deaths in the coming months. We saw the projections drop as low as 60,000 deaths, which we clearly already surpassed. And then now we've seen that jump to 138,000, which is a really harrowing number. And we know that that's a number that was not even part of the original higher estimations, which was topped off, I think, at around 120,000 previously. So it's going to be interesting to hear what they have to say and what questions the senators have for them as they also weigh sort of what the rules and regulations need to be around reopening and what this new normal is going to be like for the country, Alexis.
Anjalee, we know that New York City has been an epicenter in the U.S. for this virus. The CDC, though, now saying that the death toll in New York City may actually be much higher than has been reported. What are they saying exactly?
That's correct. And I just want to make sure we understand that this is actually something that was almost expected. We know that from the very beginning, we've talked about how there was undercounting of deaths potentially because of people who stayed at home and didn't end up, being admitted to the hospital. So the cause for death was not necessarily noted as COVID-19, as well as those that were outside the nursing home or hospital environment, whatever other accommodations they were in. So there was an anticipated undercounting. The CDC report estimates about 5,000 right now. And that's going to be something that we're going to be watching throughout the country, honestly, play out, because we are waiting to see whether or not the numbers of not just the deaths, but also the cases. We've heard the stories anecdotally about how people have been sent home without being tested, even though they show the symptoms. But because of restrictive testing and because of the shortage of supplies previously, there was a significant portion of undercounting. So all of this comes together really in the CDC report that's highlighting one aspect of it. And it's going to be interesting to see how this all plays out throughout the nation.
I want to ask you about testing because during his press briefing yesterday, President Trump seemed very optimistic about how this country is ramping up testing. What are the real numbers there, Anjalee?
Right. So we know that we've seen the overall test count, continue to climb. And this is a result of the number of emergency use authorizations that the FDA has issued. So whether you're talking about the nasal swabs or PCR testing or the antibody test, and now that first rapid antigen test that has been approved. So all of these put together have been increasing the capacity overall that the country has. And so when we're talking about being the country that has tested the most, there are also questions that arise in there of whether or not these tests include multiples for one person, what kinds of tests are they that they're counting, and where are we missing numbers, if at all. There was also some confusion at the very start about labs not being mandated to report their testing results to the CDC and to the federal government. So a lot of that has added up to us not specifically knowing, what that full count is, but we do know that we still hear anecdotally that there is more testing available, but there may still be some restrictions or some limitations, especially for the swabs. But on antibody testing, that does seem to be a little bit more widespread. We've heard of providers offering them just to anybody that needs one. So another thing that we're watching, Alexis.
All right, Anjalee Khemlani, thank you.